We have a barbershop salon program that got started a couple of years ago. What it basically entails is going into several shops around Denver. We have about 15 at this point. And we do blood pressure and glucose screening. And we do a lot of education. We partner with a number of groups, but the American Heart Association has been one of our strongest partners. And they really came aboard and said, this is a great idea. We'll help you, expand it. We'll help you put it together. We've, to date, screened over 1,200 people, both men and women, children and adults. And it's been just a wonderful addition to the community. They really appreciate us coming out and educating them. And we know that African Americans have the highest rates of blood pressure in the world. And the American Heart Association has really been a champion in our work and have shown how a partnership between community and a private nonprofit entity can work together. And it's just really been great.
I think it's important for people to understand why it's so important that we get this training, and it simply comes down to the numbers. It's estimated that in the United States alone, upwards of 350,000 people every year go into cardiac arrest. I mean, do the math. That's almost 1,000 people a day. It takes more lives than lung cancer, breast cancer, stroke, and AIDS combined. It's the #1 killer of both men and women, and that's why we need people trained on even just the basics of CPR. I think when I first started as an instructor, we were only expecting to see about 5% of the population respond to a victim when there was an emergency. Now we've seen that number go up to 20% just in Colorado, and I know it's even higher in some other states. Common misconception that people have is that you have to be certified to be able to help somebody, and that's not the case at all. Certainly you want to be trained, you want to know what you're doing. And this is not a certification, but you don't need one. But this definitely gives you those basic foundational skills so that you can actually help somebody when they need it. One of the things that I've enjoyed the most is being a part of doing some of the training through the CPR Anytime program. And if you're not familiar with that, those are the kits with the inflatable mannequins and the little how-to video. At one point, I think we had like 300 kids in front of us, all with these little inflatable mannequins. And the training itself only took about 20 minutes, but the cool thing about the CPR Anytime kits is that they got a chance to take them home. And so the idea is that it's a multiplier. And not just kids, we were able to actually go out to some corporations who were really excited about this too and do some trainings for their staff. You're teaching people how to save lives. And when you do it well and you really empower these people, it makes such a difference.
Every 40 seconds, someone has a stroke in this country. In 2008, a blood clot traveled to my brain and I had a stroke. And an ambulance came and sent me to a local hospital here. But because I didn't fit a profile of what someone who would have a stroke looks like, I sat in an emergency room for 7 hours. After they realized I was having a stroke, I was sent to a stroke-certified hospital and got immediate care. If you get to a hospital and you get treatment within a small time frame of 2 to 3 hours, there are life-saving and life-changing and outcome-changing therapies that they can do. One thing I learned after my stroke is time is brain, and it's so, so, so critical to get to a hospital that can treat you. And that's why when I was asked by the American Heart Association to help with this legislation that would have, had it been in place, been life-changing for me, I jumped at the opportunity. This legislation is going to help provide a way for every possible stroke victim to get to the appropriate hospital, because you're twice as likely to die of a stroke than you are of breast cancer as a woman. The American Heart Association is just so committed to improving people's lives, and the work that everyone does here, that you dedicate your life to help people, and it's a small thing that I can do to maybe change an outcome for somebody. What is more important than life, really?
When Tess was 4, she had an unusual heart murmur that I needed to get checked out. And I thought that I was going to go to this cardiology office appointment and have them say, she's fine. You don't ever need to come back and see us. But what actually happened is she needed surgery, and she needed it very soon.
I went to the hospital to get my heart checked, and I got lots and lots of ice cream.
When our daughter Tess was diagnosed with a heart condition, I remember leaving the doctor's office and thinking, how in the world could this happen to this tiny little person? But in reality, 36,000 kids are born with these congenital heart defects. That is 9 out of 1,000 children.
And after my heart surgery, I feel so much better.
Events like tonight and other events around the country are exactly what the American Heart Association needs, because all of the funds raised at these type of events goes toward treatment, research, and overall support for kiddos with congenital heart disease and families too.
Thank you for coming tonight, and thank you for helping kids like me.